Hello, MedTech Insight enthusiasts. This is Dr. Jennifer Joe with my co-host, the fabulous Dr. Ami Bhatt. Ami is streaming live from her office at Mass General Hospital. When she isn't hosting the show, she's running the Massachusetts General Hospital telecardiology program, seeing congenital heart disease patients, and teaching at the Harvard Medical School. When I'm not hosting the show, I see patients in the emergency room, urgent care setting, and hospice setting. We both work with a number of traditional and up-and-coming digital health startups. We both believe that healthcare can be better for the clinician and for the patients. You can hear us giving local, national, and international talks, and we have a textbook that is coming out. MedTech Insights is a live weekly interactive show led by me and Ami, where we interview two guest leaders in digital health every Tuesday at 12 noon. We love when you participate, when you write comments, when you write questions. We will feature them in the show. So if you're watching on YouTube, LinkedIn, or Facebook, please go ahead and start writing some comments. Tell us who you are, tell us where you're watching from, and we'd love to feature them. As a reminder, this is live and also recorded. You can find the recorded version on Vanguard.Health. You can watch us in a variety of different places, including LinkedIn, Facebook, YouTube, and Vanguard.Health. Be sure to keep up with us and the show by joining our mailing list, and look for us on LinkedIn, Facebook, Twitter, and YouTube. Over to you, Ami.
Thanks so much, Jen. Exciting week in innovation for us. HIMSS is ongoing in Las Vegas and virtually this week. So a lot of exciting work there on technology, innovation, and really thinking about what the future of healthcare looks like. So if you've had a chance, definitely take a look and see what's there. We've been posting about it as well. Today, I think a really important topic that we haven't had a chance to discuss it in great detail just yet. As a reminder, both of our guests today and Dr. Joe and myself are representing our own views and not those of the companies for whom we work or with whom we affiliate. But today we're going to really focus on mental health and behavioral health. So the COVID-19 pandemic and the resulting economic recession really have negatively affected many people's mental health, created new barriers for people who already suffer from mental illness or substance use disorders. And it turns out that if we think about how many people this affects in the United States, we used to have about 1 in 10 adults who reported symptoms of anxiety and depression. As of now, about 4 in 10 adults. So 40% of our population reports symptoms of anxiety or just depressive disorder. Important to recognize that also affects things like sleeping, eating, increases in alcohol consumption throughout the country, increases in substance use, and worsening of chronic disease conditions. Really important for us to have public health measures that address this, and there's been a lot of work there nationally, but this is also an opportunity where in the face of mental health issues, behavioral health issues, isolation, job loss, there's a lot that the digital health community can do. So with that in mind, we're really honored today to have 2 people with us. We have Dr. Omar Dawood coming from CALM. He is the CMO there. And we have Dr. Jose Hamilton Vargas, who's the CEO of Youper, both of whom are really able to help the community, both in the US and globally, think about mental behavioral health. So it'll be really great to bring them on. We'll start maybe.
It will be really great to bring them on. We do have just such a great audience who's watching right now and saying hi. So I know you're about to introduce them.
That is okay. We love introducing our audience too.
I love introducing our audience. I should call it out that I should ask our audience more often. So really excited to have Nizam Mia, who is watching. He's the president and CEO of your GI Center. Nice to have you. Great to have Gary Singer. Gary Singer is a nephrologist along with me. Good to see you, Gary, Dr. Singer. And he trained at MGH and Brigham, but before I got there. So he is a partner at Midwest Nephrology Associates. Great to have you watching. As always, wonderful to have Denise Silber watching, who we've had on our show before. She's the co-founder of VR for Health, also the founder of Doctors 2.0 Event Consultancy. Love when you tune in, Denise. We also have Joe Kenyeri, who's tuning in. He's a community instructor at St. Joe's Healthcare Services. Great to have you. Joe. They just keep coming in. I'm sorry.
Wonderful. This is a global presence today. It's exciting.
Great to have you watching Niranjan Swami. He's the founder and CEO of medapp.in. Great to have you participating. He is in Bangalore, India. Wonderful to have MedTech watching from all over. And then Matthew Van Eman, who is a lawyer and also physician in the Boston area. Great to have you watching. So shout out to everyone. Please continue to write in and also share any questions. Ami, you wanted to do some intros.
Absolutely. We'll start by introducing the CALM CMO, Dr. Omar Dawood. So Omar is a stage 4 cancer survivor. He's a physician and he's the chief medical officer at CALM. He says he's passionate about helping people live happier, healthier lives through innovations in both mental and physical health. So let's start by bringing on Omar.
Jen, great to be here. Appreciate it.
So excited to have you. So I guess a few things. The first is being the CMO of CALM. Omar is excellent at actually kind of setting the mood, if you will, for how we're going to engage. And so perhaps, Omar, before we even do your origin story, which actually is a winding road, you didn't just end up at CALM. So I'm excited to share that with the audience. I think you wanted to start us with a little experiential event, if I have that right.
Yeah.
Sorry, I just wanted to mention that Matthew Van Eman, the lawyer and physician from Boston, is a regular CALM user.
Excellent. Thank you, Matthew. Appreciate it.
Well, listen, so Matthew, we're going to meditate together with Matthew. So let us know how it goes. Okay.
I love that. Yeah, I just think we move so fast, and everything is moving a mile a minute, and there's always what's next. I think in the spirit of our mental health and learnings from this past year as well, what's been highlighted, let's slow down and go faster. Let's take a few minutes here, listen to Tamara Levitt from CALM, and really kind of have her set the tone for us as we get started. Let me just share my screen for 1 second. There we go. All right, you can all see that?
Perfect.
Welcome to this 3-minute guided body scan. Start by sitting comfortably with a straight back and close your eyes. Take a few deep breaths in and out to ground you in this moment, feeling your breath as it enters your body and as it leaves your body. As the breath flows in, follow it in. Then as the breath flows out, follow it through to its completion. With each out-breath, let your body become heavy, sinking deeper into your chair. Now bring your attention to your head, feeling into your scalp, the forehead, and temples. Observe your eyes, cheeks, your ears, jaw, and chin. Breathing in and out, letting all tensions release. Now lower your focus to the neck and shoulders, letting them soften. Bring awareness to your arms, extending it down towards the wrists, the palms, and fingers. Observing any sensations that arise on the surface of the skin or deeper within. Now come to the chest and torso area, being aware of the abdomen, and bringing your awareness around to the back, observing your upper back and lower back. And if you notice any intensity here, try directing the breath into those areas, letting them soften. Then bring your attention to your pelvis and hips, and scanning the legs, the ankles, the feet, and the toes. Direct your breath into these areas, relaxing into stillness. Notice how paying attention to the entire length of your body feels. Then, when you're ready, bring your attention back to the room and slowly open your eyes. Enjoy this relaxed, peaceful state and take it with you into your day.
All right. Always a great way to get started, in my opinion.
This is excellent. I'll always enjoy doing that. Really should make time to do it more. Omar, start us on your journey, because you and I met, a quarter of a century ago.
25
right?
years ago.
Quarter 25 years ago. But the audience doesn't know you yet, and you have been an entrepreneur, an innovator, a patient, a physician. Just take us through a little bit how you ended up with Calm.
Of course. So my journey really started off as a teenager. I didn't pick this course necessarily. It picked me, which is oftentimes a good thing, as our environment defines us oftentimes. I was diagnosed with stage 4 Hodgkin's lymphoma when I was 15, and was thrust into a hospital-based environment that was very different from what you see on TV as a teenager. That's glamorized. I saw an environment in which you had a lot of very caring clinicians and staff and everyone around that was really well intended, but very little innovation in the hospital. Empathy didn't translate well from department to department. My journey and care was dictated oftentimes by my own memory recall as a teenager, which kind of staggered me. And I didn't really connect the dots, or couldn't at that point, on how all of that translated into measurable value-based care. And so for me, when I finished treatment and I was 17 or so, I remember sitting in bed one night saying, I'm going to change this. I want to change this. I didn't know how as a bright-eyed teenager, but sought off to really gain a foundation in public health to begin with. I always thought that epidemiology was an amazing basis to be able to bring to bear the best of outcomes and evidence and drive care decisions. And then from there on to med school and then training in surgery and radiology, and then vascular interventional. And did that in San Francisco, where I had the quote unquote valley in my ear, where you're seeing innovation. And I asked myself the question is, I love one-on-one patient care, but how can I actually affect millions more people with a single stroke? How can we start thinking of resource allocation and access? And so, I took the big step. That's the hard step, which is step out of day-to-day clinical medicine. Stayed on with a cohort-based practice, doing some work with UCSF, but jumped into the Valley and joined a number of mostly medical device companies, and really thrust myself into situations in which I didn't know what I was doing, in a good way, right? You don't really understand marketing, take a marketing role. You don't understand finance, take a finance role, right? And across the board, the outside world becomes your best education. And through there, learned a ton about myself, and spent most of the beginning of my career in physical health, and really making great strides in innovation there. And it's been probably about 12 years or so now that since I entered the field of what we now call digital or mental health, right? And had the fortunate path to actually interact with a number of early founders and help guide them in their journeys. And I really gravitated toward those that were working toward destigmatizing and providing increased access and democratization of mental and behavioral health. Honestly, I hadn't thought too much about mental health my entire life up to that point, in my mid-30s. And you really start to realize, when you take a step back, that without us taking care of our mental and physical health, we can't really make anything else go. It affects chronic disease outcomes. It affects our daily outlook, mood, how we do at our job, how we are in relationships with our family, with our friends, with our children. And we don't pay enough attention to it. Fast forward, I was lucky enough to, help grow and be part of the amazing team at Ginger as we grew that offering for a coaching, therapy, and psychiatry full stack offering that we grew globally. And then connected with the Calm team and fell in love with the team after spending 6 years at Ginger. And Calm was doing something a bit different. Was really taking a product and experience for resilience, helping people actually engage with content that they love, sometimes not even realizing that it's actually mental behavioral health as a foundation, on a platform that's very evidence-based. Over 110 million users, or downloads, I should say, around the world, in 190 countries, and over 1,600 companies that have adopted Calm as a means for people to build resilience. When you think about where that fits in, it's funny, you mentioned 4 out of 10 people that may experience stress or anxiety symptoms. And I personally challenge those numbers a lot, because when you think about it, as last year really highlighted, every single person on the planet is a human being. And every one of us are not really designed to deal with stress and anxiety, even small amounts. But we don't prepare ourselves for it. This last year highlighted how reactive we are as a society. And efforts like Calm and other companies in the field, I think, are more and more moving in the space of what we call prevention. If we're talking to, we have a cardiologist on, actually. So we're talking to, clinicians that are focused on some of the larger, more prominent chronic diseases that we have. There's no one that's going to argue the value of nutrition, diet, and exercise, right? They're preventive means that we all should take, whether we don't just start engaging with those when we have chest pain or when we actually are at the brink of obesity. And why? Because it's shown that if you invest upstream in individuals and make that part of their daily habit, they're going to be more likely to not have untoward outcomes, right, with some of these chronic diseases. But we don't think about that with mental behavioral health, and it's time. It's time to start thinking about how do we actually build resilience, turn ourselves into rubber bands, help each other sleep better, be more open in a destigmatized way about talking about some of the challenges we have. Those butterflies you feel before a meeting, that's stress and anxiety. That's okay to do something about it, right? And so what I'm excited about here at Calm is I think we're making big strides in terms of helping, hundreds of millions of people around the world do that.
That's wonderful. I think the way you approach the concept, and the fact that you, like many of us say, it wasn't until my 30s that I recognized. And if you look at teenagers today, they're recognizing much earlier. And I think there is less stigma. Their generation puts less stigma on this than ours. And so it's a great time to build for the future, because we have people who are both willing to use digital health to engage on their own, in community, in groups, online, but also to recognize and name things. And I think that's so important. I'm watching Dr. Vargas backstage, and he's nodding furiously. So I think what we'll do is, why don't we bring him on too, and we'll all have a conversation together.
I love that. I love bringing on Dr. Vargas. I just want to welcome a guest who is watching. Thank you, Kirsten Borby, for watching from Colorado. She is an internal medicine physician, providing longitudinal clinical care for comprehensive and varied primary care practices at the Colorado Permanente Medical Group. Thank you for watching, Kirsten.
Hi, Kirsten. Great to have you. So Dr. Jose Hamilton Vargas is a psychiatrist. He's CEO of Youper, which is a telehealth company that's using artificial intelligence to make mental health care accessible for everyone. Why don't we have him join us as well? Dr. Vargas, thank you for joining us. I know, as I was watching you nod, that this is a conversation that is near and dear to your heart as well. Why don't we just take a moment for you to also kind of share with us how you started Youper and where you are now. And then we have a lot of questions that have come in already for the two of you looking ahead to the future. So maybe we'll jump in after you introduce yourself to that as well.
Thank you, Jen. Thank you, Amy. And thank you, Omar, for that great introduction. Do you want me to tell a little bit about my story as well?
Yeah, we would. How do you go from being a psychiatrist to suddenly being the CEO of a global company?
I know that it was the med school training.
Clearly, it's the med school training that has prepared us to run companies. Yes.
As you can see, I don't speak like the other guests who previously spoke in this great show. I was born in the heartland of Brazil, and the journey that led me here is I would say improbable. I was raised by a single mother with the help of my grandparents. She always described me as a curious but hard to focus kid, and always looking for new things to do and new challenges. And thanks to my curiosity, and not to my concentration skills, I got into medical school. And attending one of the classes in my medical school, a psychopathology class, one of my teachers said, maybe there is a chance that you have attention deficit disorder. And I told him, yeah, that explains a lot. After a thorough assessment, I received a diagnosis, and that was 15 years. There was a 15-year delay for that diagnosis, and probably that was the reason I decided to become a psychiatrist, because I thought of how can I help other people to get their help they need and deserve without having to wait so much time. And then that's why I became a psychiatrist. And like since I became a psychiatrist, I think I saw more than 3,000 patients in my career. And wasn't a surprise when I realized that the most common thing that I heard from them was it took me years to finally come here and get the help that I need. And probably because I was to listen to this over and over again, I decided I started having this feeling that was failing them. I tried to be there for them to prevent that that delay, but I was failing. I would say that psychiatry and mental health in general, the mental health system was failing. And that's why I decided to look for a solution outside the medical field. And then I started looking for technology and how technology can empower patients and also empower physicians to provide better mental health care. And that's why I founded Youper in 2016, and then moved to the US and quit my private practice in Brazil.
Wonderful. I say it again and again, right? The origin story of how people end up where you would never know. You would never know unless you take the time to ask. So both of you touch upon something so important, though, which is the idea that access is almost everything. And that's true for healthcare in general. Right? We fight this battle every day about access, and not only ensuring access to people, but ensuring equitable access, right? That everybody is able to get the kind of services that they need. And as Omar focuses on prevention, we recognize that we don't want to be reactionary when it comes to our mental health. We really need to make it part of the fabric of who our community is, not even just the healthcare community, right? Just how we live. But then Hamilton also makes the good point that there are diagnoses, and those diagnoses, if not made early, can actually affect people, not only their mental health and their physical health, but their ability to engage, to get a job, to interact with family, to contribute to our community, right? To contribute to, let's say, economic recovery post-COVID or during COVID. And so as we talk about access, I guess I'll ask both of you, and I know you both may have a little bit to kind of show about the companies as well. So happy for you to use that, as you're answering these questions. But when we look to the future now of kind of behavioral mental health, how are we going to do better with access? Are companies like yours all we need? Do we need multiple companies like yours? Or is there a next step in terms of digital health and technology and access that we're not seeing that is coming? So maybe, Omar, I'll go to you first and then to Hamilton with that question.
Yeah, it's a big question, interesting question. I think, first of all, the more and more innovators and entrepreneurs in this space, the better. I think if you speak to any leader of any behavioral health company, they're going to applaud new companies coming on the scene. And frankly, we all talk among each other in a very positive, collaborative way. Yes, there's competition, but it's healthy competition, and competition breeds innovation in a positive way. I think that, every one of us and everyone that we know is on the spectrum when it comes to mental behavioral health. map that to a PHQ-9 GAT7 or whatever you want to map it to. And because of that, it's unrealistic, I think, for one company to own the entire spectrum. A lot try to do that. It's like a single pill that's going to cure everything. It's more realistic that you can have companies that are going to focus on different parts of the spectrum and do it very well. And then the key is coming together in a simple way in which people can understand the options and how to navigate them. Right? I think that that's incredibly important. When I think about the future, I think, a lot of groups will say, well, you want something that's destigmatized. You want something to increase access. But what does that really mean? Yeah. For me, it's a couple fold. One is like, when I look at, Jose, I look at one of the basis of your company, you use two really interesting buzzwords, which are AI and ML, right? Powering a lot of what you do. I know we do here at COM as well as a number of other companies. I think for us to really generate the right level of access, it's not just about lining up as many psychiatrists and therapists and coaches that we can actually have. It's about actually creating a team of enabled, quote unquote, smarter clinicians that can actually, with a single stroke in which maybe we're treating one patient, can now treat 10, right? Sometimes instead of a conversation, you can put a piece of content from someone. You can put something else in front of them. You can actually have AI and ML start to predict based on mapping back to a large data set. How you should actually help support that individual. So I think that that's going to be really critical, and really, frankly, haven't leveraged enough of that with insights to really, quote unquote, improve access on a major scale that brings efficiencies. I think the other thing that we forget about oftentimes, which is going to be really critical to the success of mental behavioral health making big strides, is take a step back from the experiences and look at them. If I have an experience and I have one male voice that's representing that experience, as an example, there are so many people, different genders, different ethnicities, who are not going to resonate with that, right, individual, and therefore are not going to engage. If we think about what's plagued the majority of mental behavioral health experiences and platforms, whether it be telehealth or other means or pure content means, it is engagement. Engagement's low. The AP engagement is 0 to 3%. Behavioral health up extend that to 7-8%, but it's still very low. We're fortunate our engagement rates are well over 25%, but there's still tremendous room to grow for everyone. And the basis for engagement is that people feel trust, right? That's what mental health is all about. You feel trust with who you're with, you feel comfortable, and you identify with the person that you're interacting with. And so diversity and inclusion, talk a lot about that in the business world and in different environments, is incredibly important to how we innovate these experiences and how we innovate the future of mental behavioral health. Having a plethora of hundreds of narrators, voices, genders, ethnicities, sexes that appeal to everyone. You say, you know what, I feel comfortable with you. I'm going to open up. I'm going to share. You know what I'm going through, right? Mm-hmm. Someone in a South American country is experiencing mental behavioral health and consuming resources in a very different way. And it has a very different comfort level than somebody in Southeast Asia or somebody in Paris or somebody in the United States, right? So it's important that our experiences are tuned for that. Without that, we're applying a one-size-fits-all, and we're frankly closing the door to many, many people.
I love that concept. I think it's so true. So we see this in practice too, right? So you talked about a few things. So one is the idea of what does it really mean to destigmatize something? So I'll tell you in the mental health concept among practitioners, right? Both the burnout epidemic, that really endemic, right, issue that we had prior to COVID that is worse now. One thing we've noticed is as we start to talk about behavioral and mental health and we use the word resiliency, and you then look at how many more papers are coming out, how many more physicians and nurses and others are engaging in resiliency courses, right? Which is a little bit different than finding themselves a practitioner, which many also need to do. But it's interesting how that word has actually changed how people adopt the concept of mental and behavioral health. And so it's a very small thing, but unfortunately it was necessary to change that impression of what it means to be strong mentally, to be able to react. And so I think that was one very interesting thing. The other thing is, and so I'll tell a quick story because we started a stress management program for adults with congenital heart disease. As you were saying, people like to see people who are like themselves. And we recognize that a lot of congenital heart patients were going to somebody who's, your average psychiatrist who doesn't have those patients, doesn't know what it's like to be in and out of a hospital since you're a teenager, right, Omar? So that's kind of one of those things that's just a different experience. And when we started it, the nurses all said after a couple months in, because I used to do kind of 90-second meditations. By the way, I did use Calm. I used just the rainforest noise. I didn't use a guided meditation. I just used the rainforest noise, and we would just
not the
listen.
Matthew McConaughey guided
So I did not use
right?
Matthew McConaughey. That my patients were stuck listening to my voice with the rainforest in the background, but it worked out great. And you know, it's interesting. You find your own way to do it, but we would do it, and we would literally just do 90 seconds because my point was to prove to them that it doesn't take 20 minutes. You don't have to go take a yoga class. You can do all those things, but you can also just center yourself. And a couple months in, the nurses said to me, Dr. Bhatt, it's really great to work with you on the days where you do meditation with your patients. And I was like, wait, what do you mean? You know, why would you say that? But it's true, right? It was a way for me to get it into my practice that I wasn't going to do unless I was doing it for somebody else until I then realized. And so these are the kind of things that you realize people need a way to access it that makes sense for their life. And I think that's really so important. I think both Calm and Youper are focused on doing that, both globally and in recognizing people who are like yourself, but also in the variety of offerings that you give, because different people interact differently. Some people are visual learners, some people are oral learners, right? And so I think it really changes.
So that's Alex. A great point and segue. We have a really wonderful question from the audience. Alisser Musalem, she is a pharmacist currently practicing in Saudi Arabia. She received her training in Lebanon and the US. And she's got a great question for Dr. Dawood and Dr. Vargas. Given the generational difference in approaching mental health and calling out, you know, the tech savviness, what kind of strategy do you follow to attract older users? Great question.
Yeah, I think it's an awesome question. I mean, it's no different than if we set up, let's set up 5 concert venues, okay? Get a large space, set up 5 concert venues.
We're gonna do a concert venue for like different ages, okay?
Exactly, right? If you think about it, you're gonna have people that naturally gravitate to one of those concert venues. And I just chose 5 out of the blue because you could probably divide up ages from, 5 years all the way up to 100 by about 5. I bet you could pick, and you're generalizing a little bit, but we could pick certain music genres, certain light patterns, certain volumes, right? That are going to start to attract different ages and different demographics. With that, then, not only is the content and the way it's positioned and the individual delivering it's important, but who you've attracted. So when I walk into a venue, and the venue could be a behavioral health platform, it could be an organization, a company, you're going to look around to see if there are people that understand you, that you vibe with, right? Now you've created the venue, now you've attracted a core number of people, and you also want to attract people that people look up to. So like, for example, let me give you another example. With Calm, we have been skewed female in a very positive way. More than half of our users around the world have been female. And we wanted to continue to appeal to some male audiences, in addition, that typically weren't as engaged with mental behavioral health type of experiences, especially those that were involved in manufacturing companies and other areas or parts of the world where it just wasn't something that the macho-ness would necessarily allow them to engage with. And so we started engaging with narrators like LeBron James, as an example, who LeBron talks about the challenges of being in a Game 7 and how, he feels stressed and anxious, and the importance of sleep, right, as a foundation for his resilience. Now, we may not all be in a Game 7 one day, but we all can look at somebody like that and say, wow, first of all, never thought that person would ever experience stress and anxiety. And if he can, or that person can, then therefore I can. Now it's normalized. It's key. 2, is it's somebody that I can identify with, somebody who I will listen to because I want to model their behavior, right? And so it's picking individuals like that, not just any individual, who people in that demographic want to model behavior behind.
I love that way of thinking about it. It's really so true that you need to look up to people to be able to have an idea that they know who I am, they know where I'm coming from, and therefore I'm going to try this, right? I think it makes a huge difference. Let's talk about gaps for a second, because we have entrepreneurs out there who are working in the mental health space. And I see some of our venture capital friends who are looking to invest in the mental health space, behavioral health space. And a question that comes up a lot is what's next? So yes, the overarching platform and everything we talked about so far is important, but where are those real gaps? Where should the money go? Where should the new people who are looking at, where do I fit in? Where are those gaps? So maybe Hamilton, if you can kind of go first and tell us a little bit about the gaps in mental health care that you see, and then Omar, you as well.
Okay. So the number one barrier for accessing care is cost. The second one is not knowing where to start. And the third one is stigma. So cost is the number one problem. So we need to reduce costs. And we are seeing like the biggest innovation of this last decades for making mental health more accessible and reduce costs was basically telehealth. Let's give our doctors and therapists a Zoom link, and that will solve the mental health problem. Was an important step, but it's not enough. And I think we need to do something that will empower patients, and we also empower those doctors, just like Dr. Omar said, to instead of seeing one patient, a psychiatrist could see 10 patients, 100 patients. A therapist, instead of seeing one client, could see 10, 100 clients. And the way to do that is using technology, but not only this telehealth technology. And that's why we are giving our clinicians and doctors and therapists tools for making them more efficient at caring for the patients. And I also believe in prevention. I also believe in doing things like mindfulness and meditation. I think mental health needs to be every other, just like any other condition, physical health or mental health. We need to think about complete care. So we need to talk about prevention. Sometimes we need to talk about medication. Sometimes we need to talk about therapy, and in some cases we're talking about hospitalization because it's serious, like us thinking about suicide or experiencing psychotic symptoms. Mm-hmm. So we need to have this complete care. So I think we're talking about these two. The most important thing is reducing costs by empowering clinicians, empowering therapists, empowering psychiatrists with the right technology, moving beyond telehealth, and also thinking about complete care. And maybe this will come from one company providing all those services, or an integrated way to connect these companies. Start with something that's more aligned with prevention, but connected with a solution that could provide diagnosis, treatment by using medication, therapy, or the combination of both.
I love that idea. I think it's so important, right? It echoes both you, Dr. Vargas, and Dr. Dawood are saying something similar too, which is there is room for everybody, and then we just need to figure out how to work together, right? How do we build the right system for the right people? Now, Dr. Dawood, I would love to hear from you, but there's also an audience member who has a question. Sure. Do we want to combine those, Jen? Do you want to put that up?
Yeah. So really great question from the audience, Nicholas Turney, who is in the UK. Really love this international audience that we have. He's a technology specialist offering data management solutions for bioethics case consultations. Tricky doing bioethics. How do you encourage those with difficulty with oral communication and those who have limited ability to speak the language of the country to participate? And how can digital health help them? That's a hard question.
Omar, maybe we'll turn that to you, and then we'll ask you about closing thoughts as well.
Sure. I mean, excellent question. I would say that definitely look at the different options that are out there. Every option is using a little bit of a different medium. Some are verbal with video, some are just pure text messaging. Some are just content based. I think the key is exploring each one and seeing what you're comfortable with, not feeling that you have to do option A because everyone else around you is doing it, right? It's what option is best for you. There are also more and more options that are being set in the vernacular of that you're comfortable with, right? They're set in your own language. And so, if you're in the United States and your native language is Spanish, it doesn't matter how good the offering is in English. You don't dream, think, or really embody your everyday in English. And so it's important to seek out a offering that is not making language a new barrier for you. That you don't need another barrier. We already have enough around us when it comes to pursuing our behavioral health.
That's wonderful. So Dr. Vargas had some great thoughts about kind of gaps in the future for his closing thoughts. Closing thoughts from you, Dr. Dawood.
Yeah, I think I completely agree with where Dr. Vargas went with this. I think that, right care, right time for the right individual in the right clinical situation is unbelievably important. When I take a step back, I think there are a couple other really important things we need to think about when you think about the future of mental behavioral health. Like, where would I invest in this space? What's up and coming? We've talked a lot about prevention, and I will keep hammering that. I think dollars spent upstream are going to bear much more fruit and be so much more additive and add to what we have downstream now. And the more we can become a proactive, non-reactive type of mindset around mental behavioral health, the more it's going to behoove us to use more efficient resources downstream and give us the opportunities as well to improve intersections with improving current disease outcomes. I think the other two areas for me is that behavioral health has been very episodic. I go and see a psychiatrist, I go away for 4 weeks. I go and see a therapist, I go away for 3 weeks. I think we have the opportunity, again, by layering in coaching, by layering in upstream content, other things that are not in isolation. They're actually tying together those visits. And I'm going to use a physical health example again. If I twist my ankle and I go see an orthopedic surgeon, or if I have a heart condition and I go and see a cardiologist, I don't just go to that specialist and then not see anybody else in the meantime. I'll have a physical therapist in between. I'll have a cardiologist in between. I'll have someone in between that I can work with. I'll have exercises and diet and other things. We should do the same thing for our mental and physical health. The last thing I'm going to just say is let's doubly focus on who's actually delivering all of the mental health care in this country and globally. It's actually not our psychiatrists. It's not therapists, and it's not coaches. It's PCPs, right? PCPs, I think the last I saw.
You're going to see my mom.
Yeah.
Okay.
That too.
Primary care physicians prescribe over 80% of the medications we have when it comes to psychotropics and other psychiatric-based medications. And they have a 15-minute visit, and in the last 3 minutes, they're going to support your mental behavioral health. How can we further innovate what is frankly the basis of medicine and takes us in so many different ways and pathways to actually help PCPs or pushing a boulder uphill from a knowledge perspective, from a time perspective, and from a tools perspective to help them actually be better, improved, and enabled front lines for all of us when it comes to our mental behavioral health. I don't think we have enough innovation in that specific area, and that's going to be really important when we start thinking about kind of evolving collaborative care models and these types of frameworks for us to think about taking behavioral health care to the next level.
I think you guys have just said it so beautifully. We are so honored to have you both, COM CMO, Dr. Omar Dawood, and Youper CEO, Dr. Jose Hamilton Vargas. I think this is true not just for behavioral health. I think and Nicholas is pointing this out, right? There's so many different environments where we need to really focus on improving the access to mental health and behavioral health. But I think, and Kirsten is right, I think prevention, a proactive approach, and that mind shift, right? That shift in how we approach it, because it's an essential part. I love that. Yes, Kirsten, you're right. Yes, no, but this is great, right? The trust is a huge requirement for engagement. And I think what we're getting at is it's not just in mental and behavioral health, but when we're thinking about healthcare in general and we think about digital health, we are not replacing psychiatrists. We are not replacing primary care physicians. We are trying to use digital health platforms as a mechanism to say, there is a standardized approach that may actually be personalized and specific for people that we can create. And there is a baseline of engagement that we can help everybody accomplish, such that then our talents are used, our clinical abilities are used on top of that. And I think that's that base that we need of resiliency, of behavioral health support, of coaching, right? Whatever you want to call that, that helps us. Honored to have both of you. I do want to give one announcement, which is the Benson Henry Mind Body Institute here at Mass General. Fantastic institution that has been really thinking a lot about behavioral health and mental health for many years, but really engaging even more so in the past few years. And their course is coming up. It will be virtual. That course is in, I believe, I want to say November of this year, November 3rd through 5th, the Herbert Benson course in Mind Body Medicine. And I'll bring it full circle because Omar and I met when he was a student in public health. And the keynote speaker for this year's Benson Henry Institute meeting is Michelle Williams, who is the Dean of Faculty at the Harvard School of Public Health. She's an epidemiologist by training. And so saying that behavioral health and mental health is a public health crisis and a need and an area to pay attention could not be more true. And I think that image is shared by many people. So thank you both again for really focusing on this in your careers and with us today. And with that, Dr. Joe, I will give you last word.
Oh, thank you so much. Really appreciate Dr. Dawood and Dr. Vargas coming on the show. Mental health is incredibly important, and I think we've learned that more over COVID. So really appreciate the work that you do. And I just want to drive home the concept of access, affordability, and accessibility. Being able to access this in the comfort of your home for a much lower cost than getting to a PCP or a psychiatrist is huge. So the work you're doing is amazing. Really appreciate the audience for listening. We are actually, remind me, Ami, taking off next Tuesday? We're taking off next Tuesday.
We're taking one day. We're going to take a little break next week. We're going to give ourselves a little vacation, but we will be back in 2 weeks.
I think Ami's hiking.
I'm at a camp at a kids camp. I'm doing the doctor camp thing. Yeah. Like to volunteer in the summer. It's fun. Plus, I get to go, splash around in the splash pad with the kids. So
that's your mental health.
Yeah, for my mental health, exactly. That's right.
So we won't be here next Tuesday, but look for us the following Tuesday. So generally every Tuesday at 12 noon. If it gets a little confusing, look for us on Vanguard.Health. Thank you, everyone, and see you later.
Thank you.